Uh, Hello everyone, my name is Rajit Kaur. Today we are going to discuss about the vaping among teenagers in the York region. So these are my teammates, and this is the table of content we are going to discuss further. First thing is, what is vaping? Vaping refers to the act of inhaling and exhaling vapors produced by electronic cigarette or similar device. They are made up of chamber, heating device, mouthpiece, and battery. Vape pens and e-cigarettes are example of vaping products, and they have a potential risk like lung damage, addiction, exposure to hazardous chemicals, etc. So next is understanding teenage vaping in York region. So we have chosen the York region because the primary location for assessing teenage vaping due to its significance to the problem. York region is a perfect place to research teen vaping habits and their effects because of its metropolitan landscape, diversified population, and health infrastructure, which together provide a miniature of larger Canadian society. So as you can see in this bar graph, there's a significant difference that in 2017 it was 11%, but in 2 years it turned to its double and it became to 24%. That's why we are focusing on the vaping among teenagers. Next is going to discuss by Muskan.
Hello everyone, my name is Muskan Kaur and now I'm going to discuss the assessment part. First is a need assessment is crucial in understanding the vaping problem among teenagers in the York region. This involves reviewing existing data, engaging with stakeholders, conducting focus group and interviews, and assessing the availability and accessibility of vaping products and marketing strategies. Next is community assessed mapping is another step. Identify resources, services, and organizations that could contribute to addressing the issue. Survey and questionnaire are used to gather quantitative data on teenage vaping behavior, knowledge, attitudes, and perceptions. Environmental assessment is conducted to identify physical, social, economic, and policy factors that may influence teenage vaping in the community. This include examining the availability and accessibility of vaping products, social norms, peer influences, parental and community attitude, and relevant policies. The fifth one is data analysis and interpretation are then used to identify patterns, trend disparities, and priority areas for intervention. A comprehensive report is then prepared highlighting key findings, priority areas, and recommendations for action. This report should inform the development of evidence-based intervention and policies to address teenage vaping in the York region. Next will be continued by Harleen Kaur.
Hello everyone, my name is Harleen Corbett and now I'm going to discuss type of assessment. So why we do assessment? We conduct this kind of assessment to understand the problem. By conducting a need assessment, we gain a comprehensive understanding of the prevalence, patterns, and contributing factors of teenage vaping within the selected community. We can take information from various sources such as York Region Public Health and local schools, hospital and healthcare facilities, police and law enforcement agencies. Next. So it helps us identify strengths and challenges. Conducting a community asset mapping will help identify existing resources, services, and organization. Then that can contribute to addressing teenage vaping in York region. Additionally, understanding the strength and challenges of the community will inform the development of capacity building strategies. So, sources of information can be community centers and youth organizations, local businesses and retailers, faith based organizations, and cultural groups. Last one is identifying stakeholders and gatekeepers. To effectively address the teenage issue of teenage vaping, it is crucial to engage with the key stakeholders and gatekeeper who help influence and authority in the community. Next will be discussed by Navkiran.
So next are the like people whose perspectives are unheard in this, and that are like marginalized groups such as LGBTQ youth, low-income families, immigrants communities, and rural teenager. Those with mental health issues may have their voice unheard. And the reason behind this problem is lack of resources and stigma or culture differences, like people have from different culture and different backgrounds. Next slide, please. Next are the engagement strategies in the community assessment process. Like in this, like community participation with relevant organization, conduct target reach using cultural sensitivity method, train peer advocates from the York region communities to ensure representation and inclusivity, community-based participatory research. These all kind of strategies which will be used in this assessment of community. Next. Next are the strengths and limitations of the strategies which we used in the assessment of community. Like the strengths are it will enhance the understanding of diverse perspective of people and the increased trust and engagement of a lot of people in this, and potential for tailor intervention like health education and everything. And limitations are potential for bias and may not capture, and individual experiences additional strategy. And next are additional strategies, and there is a virtual town hall and the anonymous research system. So next will be explained by the Rajdeep Kaur.
Hello, good morning. And today I'm going to discuss about additional strategies. An additional strategies to combat vaping is partner with schools, youth centers, and healthcare providers, employ social media, focus groups, and service, educate on risk and alternatives. Next slide. Then we have to discuss about the advocacy and ethical consideration involved in vaping. It involves advocacy, lobbying for policies that curbs marketing, targeting youth, and enhance access to cessation support. Ethical consideration entails securing informed consent, maintaining confidentiality, avoiding coercion, and safeguarding avoiding minors' rights in all intervention. It's pivotal to uphold these principles to ensure the integrity and effectiveness of public health initiatives. Now, we will learn about the community nursing learnings. This assessment underscores the significance of the amplifying youth voices in community nursing. It emphasizes tackling social determinants of health and deploying tailored interventions. Prioritizing youth engagement and advocacy is imperative for community nursing to effectively combat vaping among this demographic, ensuring a holistic approach to a public health challenge. Then next, we have to discuss about the summary. In summary, teenager vaping rates in York region exceed national averages, raising health and social concerns. Collaboration among schools, parents, healthcare providers, and policymakers is vital. Strategies encompasses education, regulation, and cessation support programs. Urgent actions is imperative to safeguard the well-being of York region's youth amidst is pressing public health issue. And these are the references taken by our group members. So to refer these, thank you so much.